Hi, everyone. This is the voice of Dr. Tolulope Olabintan, and today we're going to be talking about menopause. For those of you that don't know me, I am, like I said earlier, Dr. Tolulope Olabintan of Livingspring Family Medical Center, where we help our patients live long and well. Some of you may be wondering, why do we choose this topic? Well, I've had a few of you request that we talk about menopause, how to live long and well through the transition into menopause or through menopause. And I'm really excited to bring on the guest that we have today, Dr. Sam Song. I like her name. And she is an OB-GYN, and she should be joining us shortly. Those of you, feel free to invite anyone, by the way. Invite people who you think will find this very useful. I've had patients, as they transition through or into menopause, kind of, I won't say struggle, but, have issues with, have issues with the process. Okay, of course, there's a change in how your body reacts with menopause. It's a new phase of life, and sometimes that transition can be a little tough. And so, let me just make sure we're going to talk about ways that we can ease that transition to make it not as tough. Okay. So I'm just waiting for her to join, and then we'll be able to start. But like I was saying, a lot of the things that happen, with the body as people transition through menopause can be offsetting. So, change in libido, fatigue, less energy, and of course the hot flashes, and that can signal, the upcoming menopause. And menopause, as we know, is typically a stop in your menstrual cycle. And it's not just that. A lot of things happen as well. The ovaries stop pretty much working, as it were. They've reached their end stage, and so they stop, and they stop sending or releasing hormones. And so the body has to adjust to that process. Let's see. Hello. Oh, there she is. Yes. Dr. Samsung is here. Dr. Samsung is here. Thank you guys for waiting. Hi! There's always an intro. How are you?
I'm doing great.
Oh, you look good. You look great. I'm so happy to have Dr. Samsung here. She's a seasoned OB-GYN, has been one for quite a few decades. I'm not going to reveal too much on that end. And she will be talking to us today about menopause. So without further ado, I'm going to hand over to you, Dr. Samsung. I'm going to ask you to please kindly introduce yourself to our viewers. Who are you and what do you do?
Hi, everybody. I'm Dr. Sam Song. I practice out of Washington State, and I'm an OBGYN. Actually, now only a GYN. I just gave up the practice of obstetrics, delivering babies, after 24 years, so I can focus just on the non-pregnant women.
We approve that statement. Okay, that's good. That's good. Now I know we've talked off record about some of your interests and things like that. So just real briefly, I kind of want to talk about that a little bit. What do you do for fun, and what are other side projects that you're doing that I think could interest the viewers too?
Okay. Well, right now, for fun, I'm actually focusing a lot on GYN. Really becoming more versed in the realm of menopause. My whole thing is I want to make an impact, right? Not just in my family, but in the clinical practice that I do, as well as the impact in the world. So when I'm not doing that, I am doing a lot of paddleboarding. I picked up pickleball during the pandemic.
Heard that? Cool.
Very fun. And additionally, I am interested in learning more about art, especially produced by islands in the Pacific Ocean, Oceania, that are especially at risk for climate change. So trying to preserve and highlight those things.
All right, awesome. And I think we'll include links to some of those things after the live. So great. All right, we're going to jump right into it. What is menopause? I talked about it briefly before you jumped on, but I kind of want you to to explain what is menopause for our viewers.
Okay, so menopause in the simplest form is a transition. Okay, and actually the definition of menopause is 1 year without a period. But really, we are more interested in the perimenopausal transition, right? Because that is a time of our life where our ovarian function is decreasing. We are not producing eggs, as much, and then our There's great fluctuations of our estrogen progesterone level that are really giving us a lot of these symptoms that we are having. So, I mean, really menopause, I mean, we should think of it like, you know, puberty is a transition, right? Pregnancy is a transition. You know, pregnancy hopefully lasts about 9 months, but it's a transition during those times. It's a time of great change. And this is, you know, more going into that change at this time. So yeah, think of it as a transition.
Transition, awesome. And you were talking about symptoms. Were you going to say something?
Yeah, actually, apparently there's only 2 to 3 species of the planet that where the females live through menopause. I mean, like, well, beyond menopause.
Oh my!
It's us and the toothed whale, like orca whales.
Good to know. Interesting fact. That's an interesting fact.
And yeah, so I think menopause should be embraced and, you know, not be afraid of.
Okay, that's true. To be embraced and not to be afraid of. It's a transition. Just like we're not afraid of puberty or other transitions in life. You know, this phase comes and it goes. And we thrive through it. So that's good. And now I have a fact to kind of debate with my son. He's a big, he watches the nature shows and things like that. So I have a fact to tell him too. Great. Thank you for that. Now we talked about symptoms. I know the big one is hot flashes, but what are common symptoms that you've seen in your practice and that you'd like to share?
So the most common one obviously is hot flashes and night sweats. About 80, you know, about 80% of all women experience that.
Okay.
Additionally, there's vaginal dryness or vaginal irritation. You can also have some weight gain, some mood changes, sleep disturbances. Those are the most common types of symptoms. But not everybody has hot flashes, and not everybody experiences pain with sex or vaginal dryness, and they don't all come, you know, all at the same time either. Right. So everybody experiences a little bit differently. There are super flashers where they're having them constantly, and it's affects their life. And there's other women where they may have hot flashes, but it may be very self-limiting, and no treatment is needed.
Necessary. Okay, great. One of the things I used to get a lot with my patients is, you know, also the energy. You know, they used to be able to do this and do that, and now it seems things are kind of slowed down too. I typically try to encourage them that, you know, you adjust, you know, as with every transition, you adjust. But if there's anything to be said about preparation, what would you say to patients who are wondering, well, is there a way to prepare for it? I like the fact that, you know, we emphasize that it's not everyone doesn't go through every symptom. So it's not something to be, you know, too afraid of. But is there anything to be said about preparing for it? Yeah.
I want to speak to the fatigue that you just mentioned.
Yes.
So I think fatigue is a common thing, and it may be linked to so many other things that are going on, right?
Okay.
Because if you're experiencing night sweats, for example, and night sweats are simply hot flashes that you have in the middle of the night that may wake you because you're hot. You may notice a little bit of palpitation. Maybe the palpitation then gives you a little bit of anxiety.
Okay.
So when you have that, you know, your sleep is disturbed. You don't get that deep, restful REM sleep, right? So then in the daytime, you wake up. You don't, you know, your sleep disturbance, you haven't had good restful sleep. So that may contribute to fatigue. But as we also get older, our thyroid may not, you know, function as readily, right? As we gain, you know, additionally with, you know, it's all a vicious cycle. If you're a little bit tired, you're not doing maybe the walking that you were doing.
Right.
You know, it's, you know, you kind of get into the vicious cycle where you're tired, so you're sitting on the sofa more, you feel a little bit defeated, then mentally you're a little bit more drained because you're sort of having this self-loathing feeling. So it sort of like goes on and on and on, right?
Yeah.
So I think if you're having persistent fatigue, it is super important to see your primary care doctor or primary care provider and make sure that you're not anemic. Make sure that you don't have sleep apnea, which a lot of women can have. Make sure your thyroid function is normal. And then you want to rule out the things that is easy to rule out, and then, you know, and then go from there, right? So I think we don't want to just say, oh, it's because I'm having hot flashes, right? Even though you are having hot flashes, you want to make sure you rule out the other organic causes as well in terms of fatigue.
Okay, awesome. Before we go ahead with the second part of the question, I just wanted to explain. So palpitations, heart beating real fast, almost like being, faster than usual. And it can be a little disturbing at nighttime. And I like the fact that you emphasize the importance of preventive visits, so wellness checks with your primary care doctor, just to make sure that menopause is not to blame perhaps for some of the symptoms, because sometimes it could be something else. So the second part of the question I asked was, is there a way to prepare for it? Is there anything like that?
All right. I do have an answer for that, but I think it's a philosophical question, right?
Right. Yes. Right. Yes, it is.
Because how does one prepare for like puberty, right? I mean, one could prepare for pregnancy by staying healthy, not smoking, watching your alcohol, having a great mental outlook on the impending changes in your body. Right. I think all of those things can still apply for menopause as well, right?
Yes.
So first of all, mental reset. I feel like you want to say, okay, this is a natural transition in life. It's not something to fight. It's not something to, it's going to happen whether you like it or not, right? So having that great attitude. Number two, body reset. Are we doing everything for our body organically that we need? And when I say organically, I don't mean like without pesticides or, whatever else.
Right.
Like, are we taking care of our body the way we should be taking care of? Okay. Are we eating, good food, that not high in sodium? Are we eating lots of vegetables, lean meat, good fats? Are we having a balanced diet? Are we taking good care of the cardiac needs of our body? Are we exercising? 30 minutes, even just a little bit of walking, 30 minutes a day, is supposed to increase your longevity by 24% based on a big Australian study, right? So that keeps our heart healthy, our brain healthy. And then making sure that our social network is healthy, meaning is our relationship with your significant other, your children, your extended family, your extended friends,
your support system.
A support system where you can bounce these experiences you are having, because many of us are menopausal, but we don't want to really talk about it, right? Because it's like, it's kind of embarrassing, and who wants to talk about hot flushes? Let's talk about, I don't know, the Kardashians, like, but I think like when the more conversations we have about menopause and say, hey, this is what I'm going through, how are you doing? People will give you feedback and say, yeah, what you're going through is normal. I did that 3 years ago. Yeah, it's normal to have some, discomfort with, try this lubrication, fantastic. Or my doctor gave me, vaginal estrogen. It was great. It like dramatically changed my life, So, I mean, just understanding that you don't have to suffer alone and in silence is really the beginning of an improvement of our life, right? So I think just having healthy conversations is good. So mental reset, body reset, social reset.
And I want to highlight some of the things you said for our viewers. Number one, you said don't fight it, right? It's going to happen. So it's not something to worry over. It's just part of life. I don't want to say I don't want to trivialize it, but it is important to understand that it is part of life, and this too will pass. The same things that are also important pre-menopause are important now: rest, right? Hydration, exercise, good mental health systems in place, and a support system. And so it's good to carry that and transition into menopause, perimenopause, and all that. And I got to say, there's something to be said about talking to people who have gone through it, who are going through it. It helps you feel not alone. So those conversations are important too. And I hope our viewers really took note of that, because that's important for every stage in life. There are people who have gone through it, people who can support you through the process, and who can relate to what you're experiencing and offer support just by listening or saying, you know what, I get you. I'm your people. I get you. So thank you for that.
I do want to say a couple of things.
Mm-hmm.
You want to make sure that smoking increases onset of earlier menopause, by the way. Mm. So, usually by like 2-3 years. And it seems to increase, hot flashes, sweats, palpitations, right? And it's a risk factor for cardiovascular disease, like heart attacks and strokes. The other thing that I want to talk about is alcohol consumption, especially in perimenopause, because alcohol disturbs our sleep, right? So, sometimes if you feel tired and you think, oh, I didn't get a good night's rest, you might, drink a little nightcap.
Think it's it, yeah.
Yeah, like you think, okay, this is going to help me sleep a little bit better, but actually it doesn't. It actually makes your sleep worse. So I think that's really important to, recognize as well. And as we, go through, so I just want to really put that in there, that lifestyle does make a big difference. And things like yoga, exercise, studies have shown that it does help with like your mental,
Mm-hmm.
mental peacefulness, your outlook, right? Having exercise increases your endorphins, so you sleep a little bit better, your mood is a little bit elevated. So being that, incorporating those things as part of your lifestyle is very.
All right. So to highlight the two things, especially no smoking or cut down on smoking. And alcohol is not a sedative. Doesn't put you to sleep. Doesn't give you good quality of sleep. So that's not something to invest in as a source of restfulness. So thank you again for that, Dr. Samsung. I have another question for you. Time frame. So I know that it's going to happen. We know that it's going to happen. We know it's not something to fight. But when should one expect it to come?
So most people experience it between the age of 40 and 58. So by 56, like 98% of the female population has gone into menopause, but there are those outliers that unfortunately, even at the age of 57.
I had a 63-year-old still having a period. She had every test, no cancer, nothing was wrong. She was having a period and she was really mad. I just kept telling her, your bones will thank you. Your bones will thank you, okay? Like, it's okay. She was really upset.
Yeah.
Okay. All right. So 40 to about 58.
Yeah.
Most that's the ballpark. Awesome. All right, let's zone in on hot flashes, because that's a that's a big deal. As is other things too, but main talk was more about the hot flashes. So why do people have them? I've had people who have asked, like, why hot flashes? Why does it have to be hot? Why not a cold flash? And then the second part of that question is, how do we cope with the hot flashes? And of course, we know that people need to go see their primary care doctors, see their gynecologist to have these discussions in a personalized fashion. But how would you advise, like, what's a hot flash and how do you cope with that?
So apparently almost all of our cells in our body have some sort of estrogen receptors, okay? And apparently estrogen does help with thermal regulation. So when you have great, I think the theory is that as it declines or, it's sort of going all over the place, it initiates these hot flashes. So it usually lasts about 1 to 4 minutes or 1 to 5 minutes. And for some people perceive it as very mild and self-limiting, and other people it's severe and it affects their, they're embarrassed by it because they're having severe perspiration, they have anxiety, palpitation, like their heart is beating fast, which can also trigger a little bit of anxiety. So I think you have to ask yourself, the other good news is that once you go through menopause, it's been a year, about 80 to 90% of patients, those hot flashes will diminish. So it's not something that will happen forever, or it'll be very, much less, I should say. So having said that, you have to ask yourself, how bad is this? With anything, do I need medication? Do I need intervention? Or is just having a cold drink next to me, avoiding spicy food, having some ice, a cup of ice, having a fan that you stick to your iPhone, maybe enough, stuff like that, right? So you have to understand what your triggers are, because everybody's triggers are a little bit different.
Okay.
About a year ago, I always run up the stairs when I go to my office. Okay. And for about a month, every time I ran those stairs up, I would get to the top of the stairs, and all of a sudden, I'm like, oh my God, why am I so hot? Am I out of shape or something? It was so hot. I'm like, it's still winter. What's going on? And it would last for this 5 minutes. And even for myself, like a month later, I'm like, I think that was a hot flash. I'm not sure, because it just kind of went away. So I think you have to find things. You have to be cognizant of what your triggers are. Either try to avoid it, reduce it, and have what you can do to mitigate those. The fan, ice drink, eliminating spicy foods, maybe opening the window a little bit when you go to sleep, sleeping with a colder temperature in your house. Sometimes just those environmental modifications can make a difference. Now, in terms of food, people talk about phytoestrogens, like soy. I think you have to eat a lot of soybeans to make that much of a difference.
A whole lot.
A whole lot. But Asians tend to have less hot flashes than Caucasians or African Americans.
Right.
So could that be it? Maybe. I'm not sure. People talk about black cohosh. The randomized controlled trials don't seem to indicate
they don't agree.
It's not going to hurt you. So, if you find that to be the thing that's helpful, great. Some people talk about valerian root. So, there's a lot of different products, but as physicians, we're based in science, and we rely on randomized controlled trials to really tell us, is this effective, is this not effective, against placebo, right? So, I mean, you can do supplements. There are many that's out there. I'm never going to say don't do that, but you want to just make sure that is, if that's your thing, that's okay.
Yeah, it's safe for you, and that's a conversation to be had with your, your own personal doctor. And also find out, is it helping you? Have you noticed a difference in starting it? Is it causing any side effects? So it's individualized as far as supplements. And yes, the black cohosh and valerian root, I've actually had to recommend for a few patients who tried it and said it worked, and I've had a few who they were like, no, didn't do anything.
Yeah.
So that's something that kind of sit and talk with your doctor about. My next question is going to be about mood swings, just briefly. I've had quite a few patients say it's almost like night and day, and for them, medication is not something they wanted to take or something they wanted to use. They were just taken aback at how much their moods could change in such a well, not short time, but over a couple of months as they transition into menopause. Any tips on how to cope with that? And I think you already alluded to some of them, but I just wanted to reemphasize.
Yeah. So this is a common question I get in the office. Patients distressed because their mood swings are wild. They have wild mood swings and often coincides during this perimenopausal transition. Again, it goes back to how much of it is affecting your life and relationships with other people, because we don't live in a relation, right? And just like a young woman who's going through puberty, where we see, they can experience great mood swings,
right? And pregnancy.
Not all of them need to be medicated,
right?
So I have a teenage girl, so I have two. So I mean, it depends on severity, because hormone replacement therapy, really, if you were thinking about hormone therapy like estrogen, progesterone, as your panacea, it may not be the thing to help you. Okay. For mood swings, if it's severe enough that it's affecting your relationship, that really should be a discussion with your primary care doctor. See if pharmacotherapy like Paxil or Celexa or Prozac is a thing for you. But we also know that cognitive behavioral therapy does work a little bit with mood swings, right? So that's another thing that could happen. And then ask yourself, what are the environmental factors that could affect moods? Sleep,
right?
Caffeine intake, alcohol consumption, drug use can also affect moods as well. So it is a multifactorial, condition that can affect mood, and also, again, severity of your symptoms in terms of whether or not that is something that needs treatment, pharmacotreatment.
Okay, and just to kind of explain, the cognitive behavioral therapy has to do with you seeing a therapist to work through certain thought patterns that are contributing to the mood swings too, without the use of medications or in conjunction with medications. So those are options available to you as well, and of course you could have that discussion with your primary care doctor and go from there.
Yeah.
All right, great. A lot of useful information.
In terms, can I say? So in terms of menopause, right? When we turn 50, there's still 40% of our lives are spent in menopause. If we go into menopause at the age of 40 and our life expectancy is 86, 90, that's 40% of our life. And I think the other thing that I want women to understand is that menopause, it is a transition, but typically it's marked with, it's a period of life where typically we can focus more upon ourselves, right? Because childbearing is done, typically career is done. Right. We're usually a little bit more financially stable now than we were in our early 20s.
Right.
And I think we tend to, maybe unresolved issues may come up a little bit that we bury deep as we were in career building, family building, wealth building, whatever it is we were doing. Some of those issues may surface up during perimenopause, right? And in the menopausal transition. So I think it's okay to meet those issues head on and really embrace it and face it on head on, and really work on ourselves and enjoy. Let's do it. We're gonna be, we're stronger. We typically don't care what other people think about us. So
been there, done that. Nope, no.
We're like, F that. I don't care. I mean, we're not trying to fit into a mold anymore. We have more confidence in ourselves. We typically have a little bit more money that we can do what we want. So I think it's really important to embrace it and have fun with it. Yeah.
Embrace the process, enjoy the journey, and just enjoy that phase. Menopause is a time to be celebrated, hot flashes and all.
Yeah.
Okay.
And also, your gynecologist or your family doctor can really help you with the other symptoms. You know, painful. Don't be afraid. You're not alone. We can help you with painful sex. We still want sex to be enjoyable. I have patients who are 80 still having sex. It's like,
I don't have to worry about being pregnant.
I know.
You know what I'm saying? Yes.
You don't have to worry. Yeah, you don't have to worry about being on your period anymore. You don't have to worry about cramps and, you know, the endometriosis, all the symptoms of endometriosis. No more pregnancy scare. Yay! You know, like, just go wild. Have fun.
I like that. I like that. You know, it's all about perspective, because it doesn't have to be seen as, oh my God, menopause is coming. It's, oh my goodness, I'm transitioning again. I want to enjoy this time of my life. What are things I could do different, or what are things I can amp up? What are things I can decrease? What are things I should avoid to enjoy and thrive through this process? So awesome, Dr. Samsung. Now to wrap up, I'm going to ask for 3 tips just for our viewers, because we've had people join. So what are 3 tips to thrive through menopause? And I know you've spoken about them, but if you could give 3 for those who joined us later, what would you say?
Number 1, talk about it. Talk about it to your girlfriends. Okay. Have a
Talk
tribe.
about it.
Yeah.
Like it.
Have a tribe of women that you can just bitch with. We're adults. We can talk about this. I mean, talk about it. Okay. Number 2, I think it's super important to keep yourself healthy. I don't mean weight loss. Okay. I mean, we're beyond that. You just want to stay strong. You want to stay strong. You want to stay flexible. You want to stay balanced. You want to do the things that you still want to do, right? Go on a hike, or, you know, without getting winded, or be able to run around with your kids or your grandkids.
Your grandkids, yeah.
Yeah, if you have grandkids. So stay healthy, right? And then number 3, enjoy the relationship with you have and have.
I like that. So number 1, you said talk about it. Very important. Okay. No one is self-made, and no one is an island, or should be an island. So talk about it. Find your tribe. Lean in. They lean into you. You lean into them. Number 2, be healthy. For every phase in life, this is very important. And number 3, enjoy the relationships that you have and have fun. Have fun. Every day is a gift, even through menopause, hot flashes, and all. Awesome. Thank you so much, Dr. Song. It was really awesome having you here. Now, for our viewers, and for those who will watch this later, where can people find you?
I'm on Instagram as FAAFP. I'll put it in the chat.
Awesome.
And I'm a practicing physician out at Good Samaritan, you know, in Puyallup. So if you live in Puyallup, you can find me in my office.
Awesome. Awesome. Thank you so much for coming. It was an honor. And thank you guys for watching. Please share with your friends and their friends. And for those who will find this helpful, please share with them as well. It's been great. And I look forward to seeing you guys at the next live. Have a good one. Dr. Olabintan signing out. Thank you so much.
Thank you so much.
Have a good one.